Teeth with vital pulp and stage 3 periodontitis unresponsive to therapy exhibit a pulpal inflammatory profile similar to symptomatic irreversible pulpitis by Henry Duncan Group, published in the International Endodontic Journal in 2024. It is considered an observational cross-sectional study with subsequent longitudinal follow-up. So this study explores the relationship between periodontal disease and pulpal inflammation, focusing on teeth with advanced stage 3 periodontitis that have vital pulp but are unresponsive to periodontal therapy. The authors suggest that these teeth may exhibit similar inflammatory profiles to the teeth with symptomatic irreversible pulpitis. This raises a question about whether there might be a shared inflammatory pathways and whether the root canal treatment could benefit these unresponsive periodontal cases. So their aim was to compare the expression of inflammatory biomarkers such as tumor necrosis factor alpha, interleukin 1 beta, interleukin 10, and specific microRNAs in the pulp tissue of teeth with normal pulp, NP, teeth with symptomatic irreversible pulpitis, IP, and teeth with advanced periodontal disease unresponsive to therapy, EP. So, this study included 30 patients or 30 pulp tissue samples were collected and analyzed by QRT-PCR to measure the levels of inflammatory biomarkers. And patients in the EP group were monitored over 1 year period following root canal treatment with a periodontal health outcome assessed at follow-up. The results suggest that irreversible pulpitis and EP group showed significantly higher levels of tumor necrosis factor alpha and interleukin 1 beta compared to the control group, suggesting that an inflammatory response. Additionally, interleukin 10 levels were lower in the EP group than in the irreversible group. Both mRNA were downregulated in the irreversible pulpitis group and the EP groups compared to the normal group. After 1 year, patients with the EP group demonstrated improved periodontal health, including reducing probing depth and tooth mobility. So, this study found that teeth with irreversible pulpitis and unresponsive periodontal disease shared similar inflammatory profiles, suggesting a possible inflammatory connection between the pulp and the periodontal. And this preliminary finding indicating that root canal treatment might benefit advanced periodontal disease cases that do not respond to conventional therapy through further studies are needed to confirm these results.